Oculoplastic surgery includes a wide variety of surgical procedures that deal with the eye socket, eyelids, tear ducts, and the face. We spoke with Dr. Jennifer Hui of Desert Regional Medical Center in Palm Springs to learn about this specialized surgery for the eyes and face.
Our specialty deals with cosmetic surgery of the eyelids, Botox, facial fillers, as well as functional work such as orbital tumors, orbital fracture repair, eyelid reconstruction after trauma or cancer, and treatment and correction of tearing problems. A very common complaint is excessive tearing, and it's a problem that a lot of people live with, but I find that the majority of the time is that the underlying problem has not been correctly elucidated. So a proper tearing evaluation requires looking at more than just the tearing system. You need to look at the eyelids themselves, the way they function. Are they closing completely? Are there any surface disorders of the eye that might cause excessive tearing? And then, of course, we need to check the tearing system itself. So it usually involves irrigating the lacrimal system. So we just flush some saline solution down through the tear duct, and we'll ask the patient if they feel the fluid in the back of their throat or in their nose. And if you don't feel the fluid, that can indicate that there's a blockage along the way in the drainage system. There's a variety of ways to correct tearing problems. It, of course, depends on the cause of the problem itself. So if there's an eyelid malposition, such as the eyelid turned in and the eyelashes are rubbing against the eye, we can use a short outpatient procedure to put the eyelid in the correct position. Other people have tearing because the eyelid is actually turned outward, so the drainage duct in the corner of the eye is not facing the eye. So it's akin to the drainage hole in the sink not being aligned with the sink. So the tears are not able to flow into the system in the most direct fashion that they could. So again, it's an outpatient procedure where we correct the position of the eyelid. If there are any surface disorders of the eye, we need to find the cause, and sometimes it's medical therapy that's involved. Lastly, for the tearing problems, if it's a blockage within the tear drainage system itself, sometimes we can use a probe to break through the blockage. Sometimes you can't break through the blockage and you actually need to do a surgery to bypass the blockage. Dry eyes is also a very common problem, so again, we have to find out the exact reason why. Very rarely is it actually that the gland is not producing enough tears itself. There's usually a combination of factors, including not producing enough tears, oily gland disorders of the eyelids, that the oils are not produced in a sufficient amount, and so the tears are evaporating more quickly than they otherwise would. Sometimes the tears can evaporate too quickly because the eyelids are actually not closing all the way. So some patients have difficulty closing and they don't know, and it often happens during sleep.
Dr. Hui discussed the numerous eye injuries that can occur.
Trauma happens more frequently than you think. It can be from car accidents, assault, simple accidents in the home, children running, they fall on a broken glass, or they get a pencil near their eye. So a thorough exam involves looking first and foremost at the eye itself to make sure that it's still intact. And secondly, we looked at the periorbital tissues. Are there any breaks in the bones around the eyes? Are the eyelids themselves damaged? And most especially, we need to look at the tear drainage system in the corner because it's a very susceptible area. Sometimes you can have what seems to be a very superficial cut on the eyelid here, but actually the depth of the trauma is much more involved than meets the eye. And oftentimes the tear drainage system itself has been severed, and that requires putting the pieces back together so that the tears can drain out as they should.
Dr. Hui tells us about the success of eyelid surgery on her patients.
So the vast majority of patients do very well after cosmetic eyelid surgery or reconstructive eyelid surgery, and especially after tearing surgery. Most patients are very pleased after the tearing correction surgery because they've learned to live with carrying tissues for so long and constantly dabbing their eye and living with irritated skin from wetness, and most of them are just extremely appreciative and very happy after we correct the tearing problems.